I'm Dr. Amy Killen, and this is the tutorial on how I use the mpgun to do regenerative injections on the face. Now, depending on how deep you're injecting and your patient's pain tolerance, you may want to use a topical numbing cream, although I find that this is not necessary at the superficial kind of mesotherapy depths. In this video, we'll talk about the settings for a typical face or neck dermal mesotherapy session with the mpgun. Now, if you've ever injected a face, you know that the dermal thickness and sensitivity vary depending on where you are on the face, the age of the skin, and the health of the skin. In this video, I'll give you some general recommendations, but be sure to adjust them based on your specific patient's needs. So for the mpgun settings for those dermal mesotherapy injections, the press is going to be about, the press starts at 20%. The depth is between 0.5 and 2.5 millimeters, and the frequency is usually between 0 and about 60. So those depth recommendations are going to vary depending on where you are on the face. So for instance, periorbital, we know we want to go lighter. We want to maybe do 0.5 to 1 millimeter depth. Forehead, 0.8 to 1 or 1.5 millimeters. Cheeks and chin, you can go a little deeper, 2.5 millimeters. And neck, depending on the health of their neck skin, 0.5 up to maybe 1.5 millimeters. And like the scalp, if you want to use the MP pin, where you're doing the kind of microneedling for like smaller treatment areas, then the depth is usually between about 1 and 2 millimeters. The press, again, is 0 to 5% or so. Now, I will say that if you have another microneedling device that you've used before for the face, it is much faster than using the mpgun to try to do a micro needling kind of session. You'll see that with the mpgun, you really can only treat a small area at a time, and it's just not the most efficient way to treat an entire face with microneedling. Before doing skin regenerative therapies, make sure that you are setting realistic expectations with your patients. So these regenerative therapies for skin, this dermal mesotherapy, the injections, the microneedling, these are great for improving the health of the skin. So you can see improvements in things like texture and tone and color. You can see improvement in fine lines. You can see kind of evening out. You can see reduction of scarring. And all of these things can certainly happen. It is a slow process. Usually it happens over several months. And oftentimes you need to do multiple treatments. Typically 3 is a good number to start with. You are not going to see significant improvements in things like volume of fat. You're not going to see improvements in things like facial volume. So if you are needing extra volume in your cheeks, this is not going to be the way to get it. It's also not going to give you like a facelift look. You're not going to be removing sagging skin, right? It is improving the quality of the skin. Certainly the skin looks healthier and it is more vibrant, it's more glowy. The fine lines are improving. And it's great to pair with other things. You can pair these treatments with a laser. You can pair it after, you can do it after a facelift. You can do it after fillers. But they all have their own place in aesthetics. And so make sure that you understand that so you can discuss this with your patient. Because you don't want to have a patient who thought they were getting a facelift kind of effect, and instead they just have healthier, glowier skin, right? For the procedure itself, number one, if you're doing injections in the face, anywhere around the mouth, you want to make sure that they don't have a history of oral herpes infection. If they do, remember to give them a prophylactic medication, antiviral like valacyclovir. Obviously, get your written consents, take your pictures, prepare your device as we discussed. I like to use the plastic tip with the little notch in the end for the skin injections. And then you want to prepare your injection solution. It's usually going to be between about 3 and 8 mLs. The volume of your solution will depend, again, on the size of your treatment area and whether you're doing microneedling afterwards or not. I'll give you some general guidelines that can be adjusted based on your specific patient and your experience. So for the face mpgun dermal mesotherapy injections, I'm usually using about 3 mLs of fluid. For the neck mpgun dermal mesotherapy injections, about 2 to 3 mLs. And then for microneedling, I usually use about 2 mLs of liquid per treatment area, and I apply that afterwards. For cellulite, lipolysis, and scar treatments, you're going to use variable volumes depending on what's required. All right, so the first step is to prepare your patient. The patient is usually going to be supine or up at about 45 degrees. You want to use a topical numbing cream. If you use a topical numbing cream before, which you don't have to unless you're doing deeper injections, but if you do, obviously remove the cream before you do the procedure, drape the patient, protect the clothes. You want to clean the skin with your solution of choice, like chlorhexidine, 2 to 4% and 70% isopropyl alcohol, or a 70% isopropyl alcohol alone, and then let it dry. Begin the procedure by injecting your solution using that notched tip, keeping the device mostly perpendicular to the skin at all times, and you want to keep the skin taut as you're moving the device around on the skin. Injection should be within about 0.5 centimeter to 1 centimeter of each other, depending again on what you're injecting, how deep, and what your desired effect is. Proceed with injecting the rest of the face in kind of a grid type pattern, changing the needle depth as needed, depending on the area that you're injecting, and focusing more on areas of need. So for instance, if you have an area of hyperpigmentation or scarring, obviously you can do more frequent, closer together injections in those areas. If you choose to use the MP setting, the needling setting, or you do your own microneedling afterwards, you can certainly do that. Apply a glide beforehand, and then you want to apply the serum or your topical solution of choice afterwards. When you're all done, wipe away any blood, make sure he or she looks presentable, and then send them out, preferably keeping some of that good regenerative solution on the skin so it can continue to soak in over time. Home instructions and follow-up may vary depending on what you're injecting, but in general, I like to make sure I give a good quality skincare for home, including a mineral sunblock, which you want to use daily, as a moisturizer and some kind of active serum. You want to have them avoid the skin or be very careful with skin protection because there always is a risk of post-inflammatory hyperpigmentation with any kind of needling of the skin, although it's very rare. Ideally, you're doing 3 sessions spaced about 4 to 6 weeks apart, just like you are on the scalp. And that's it. The things that I tell patients is you should see improvement in skin texture and tone and color and glow and things like that. Some fine lines should get better. This is not going to get rid of all of your wrinkles. It is not a facelift. You have to set realistic expectations with this procedure, but it can make a big difference in the quality of the skin. However, is not going to improve things like the volume of the facial. It's not going to improve the volume of the face. It's not going to change the fat distribution in your skin. It's more of a skin treatment than it is a full face treatment, if that makes sense.